spine is one of the newer blocks that we've been doing relatively regularly. And to me, they are the block of the future, I guess I would say, is because the nice thing about the erector spine muscles, or the erector spine blocks, is you can select what level that you're actually looking for. Versus, I know I talk a lot in the lecture about paravertebral blocks. The downside of paravertebral blocks, like we talk about in the lecture, is the steep angles at which you gotta take to be able to get below those transverse processes. The nice thing about doing the erectors is that you don't ever have to go below, and you can get relatively similar coverage. Again, another advantage to them is that you can actually select what your target dermatomes are. So say if we're talking about doing breast surgery, what are we looking dermatome-wise to cover for breast surgery? Usually 2 to 6, right? But if I'm talking about doing abdominal surgery, say I'm talking about doing a low transverse incision, and instead of doing TAPS, I wanna do a low transverse incision for a total abdominal hysterectomy, well, I'm gonna choose probably T11, right? Because I wanna cover all the way down to T12, but all the way up to T10. Now, if we're talking a full X-lap incision, now we're gonna be talking about more like T8, T9, all the way down to T12. So I'd probably do multiple levels. I'd probably do like a T9 or a T10 and a T12 together to kind of get like overlapping coverage with those blocks. So let's say, for example, we're going to do his hysterectomy, right? And we are looking to, we're going to be shooting for, say, T11. So, pull gel. Again, I'm looking for bony structure, so I'm going to turn my gain up relatively high. And so I'm going to come off midline, about mid-clavicular line, and I'm going to start inferior, and I'm going to slowly kind of come up until I see our first rib, right? So there we go. We're looking at our first rib right there in the center of the screen. This bony structure, kind of roundy ribs, right? Now, as he takes a deep breath in and out, we're going to look for the lung field. Boom, there's the lung, comes down and goes up. Now, one thing that tells us that it's the 12th rib is notice how the lung field kind of comes up to the rib but doesn't go down below or inferior, which would be the left-hand side of the screen, because my probe is oriented in like a parasagittal approach, right? Take another breath in and out for us. Lung goes down to the 12th rib and stops. So we're gonna take this 12th rib, we're gonna come up, we're gonna find the 11th rib right there. That's our target, right? That's what we were shooting for. So now notice how the rib is like nice and roundy right there. As I come back over medially, you're gonna notice the rib kind of dives away, gets deeper, deeper, deeper. Just stay in that orientation. There we go. There is our transverse process. So notice the transverse process, how flat it is. Right there in the center of the screen. Go ahead. Yep, right there. Transverse process. Go ahead and freeze that image for me. That's all you're looking for. All you need to do is find the tip of that transverse process. Your needle insertion, I'm going to come from superior to inferior. Like if I was standing here doing the block, I would have my left hand holding the probe, my right hand holding the needle. I would be bringing my needle tip in, and you're going to contact the top of the transverse process, and all you're doing is this the erector spinae muscle right here. You're looking to have your local anesthetic run all the way up and down here, so it lifts this erector spine muscle up. Again, this is a plain block, just like doing a TAP block or a quadratus lumborum block or a PET block. You're not finding the nerves, you're just putting the needle and the local anesthetic in that plane. So you're saying, okay, what happens if I get confused from roundy rib over to transverse process? Let's get that in. There's transverse process. Well, what happens if I'm too far medial? So too far medial, you're gonna get this slanted image. Notice how you kind of see the lamina here, here, and here. It's a little deeper, and you can see more than one in an orientation. And if we come all the way over to midline, notice how now we're super shallow and we're seeing spinous processes there. So he's thin, so we could use our linear probe. But say you got somebody that's a little heftier, and you need to use this, you can totally use your curvilinear probe. The other thing that the curvilinear probe does allow you to do is it gives you a little bit more of a wider field of view, right? So you can actually see 2 transverse processes in it at a time. So again, we're going to come in here. We're going to look for that roundy rib, so we see that 12th rib right there. Breathe in and out. Take a deep breath. That goes down to that 12th rib and stops. We're gonna come up. We're gonna put our 11th rib in our view as our target. I'm gonna just shallow up because we don't need all that depth on him. So we got roundy rib, slowly coming over. Notice how the rib starts to dive away. As the roundy rib goes away, now we can see our nice flat transverse process. So let's put two of those transverse processes in the view at the same time. So there's two of them right there. Right, now if we continue to come over medial, so notice like that sawtooth appearance right here. So you kind of see that sawtooth appearance right there. That sawtooth appearance is your superior and inferior articular processes. There's those superior and inferior articular processes, kind of that sawtooth pattern. There's your lamina as we come over a little bit more medially. And there's your spinous processes right there, straight midline. Now you can choose that block anywhere up or down. One of the most recent applications that I've been using this for is total hips. Okay, total hips are notorious for like having a hard time finding good peripheral nerve blocks. We did the old school 3-in-1 blocks. You know, the fasciolateral blocks or the old school 3-in-1 blocks to try to get that coverage, working with really good coverage, because especially on those lateral incisions to our anterior incisions, trying to get those anterior hips, we were just not really getting good coverage. So now we started doing peng blocks in combination with the erector spines. We've been getting fabulous coverage with those.